an honor to have you guys firstly support us and agreeing to actually be able to share your story in terms of the work you do. So on behalf of Australian Sickle Cell Advocacy, I just want to thank you again from the bottom of our hearts to be able to actually support us. I'll just see, maybe she is in the attendees. Not yet, sorry. Ginger, we are on now. Can you come on, please? Yeah. Thank you, thank you. Thank you. She's awake, she's in New York. She's awake, she'll be joining us soon. Yeah, so again, thank you so much for supporting our organization. You know, when we started advertising, we thought, who can I reach to? And you guys are my role models for what you do. And not just for being in this space, but even for the kind of work that you do for the rare disease community. So on this panel, we've got Heather Renton, who's a CEO for Swan Australia. She's one of the people that I look out to in this space. We have Monica Ferry, who's also a CEO for Genetic Services Network Victoria. Did I say it right?
Almost.
Yeah.
Genetic Support Network Victoria.
Yes, yes. And she actually, we are members for their organization. They support us as well. And I've got a good friend of mine, Toyin, who's in Nigeria at the moment. She's a sickle cell advocate. She's also a sickle cell warrior. She'll tell you a story herself. So again, thank you. The reason why we put this up is just trying to emphasize the reason why we do this. And for all of you on this panel, I'll say we are a young organization and we look up to you. So we are doing this your way, whether you prepared some slides, we can go ahead and do your presentation and then we ask questions at the end. Or if you want to speak first, just let me know how you want to do this.
I'm happy to roll with our presentation. Monica and I have worked on a presentation. So we thought if we do that, then people might think of questions around our presentation and we can continue the conversation. But is that going to work for you, Toyin? Are you happy if we do that?
Yeah, I'm just speaking. I'm just speaking from the heart. So it's fine. It's fine.
Do you want to go first then? Do you want to speak first or do you want us to speak first?
You go ahead.
Okay, I'm just going to share my screen then. And let me tell me if that's working for you. Yep, all good. All right. So Monica and I are going to talk about the importance of advocating for rare diseases, an international discussion. But before we begin our presentation, we want to acknowledge the traditional landowners of where we're speaking from. Though I have a feeling Monica might not be speaking on the land of the Wurundjeri people.
Yes.
Oh, you are? Excellent. And pay our respects to their elders past, present and emerging. So, about Syndromes Without a Name. Syndromes Without a Name was established in 2012 and it provides information and support to families caring for a child with an undiagnosed or rare genetic condition. And we consider support also comes through advocacy, systemic advocacy. So I'll pass over to Monica and she can talk a little bit about the GSMV and what they do. And we're sort of going back and forth with the slides. So over to you, Monica.
Thanks, Heather, and hi, everybody. And thank you, Agnes, for the invitation. It's great to be part of this conference. So the Genetic Support Network of Victoria has been operating for more than 20 years now in the state of Victoria in Australia. We are an organisation with a mandate to support people living with genetic, undiagnosed and rare conditions and those who support them. So that includes patient organisations, it includes all of the people that are part of the care continuum for people with genetic, undiagnosed and rare conditions. So families to health professionals to our social service supports and all kinds of support. So mental health, for example, navigating the health system is another example of the kind of work that we assist families and patient support groups to support their communities with. And advocacy is one of those things as well. Thanks, Heather.
Okay. So we want to start off this discussion about exactly what is advocacy. And advocacy means different things to different people, but it's really about speaking up to support the cause you're passionate about, or speaking up on behalf of a person who is unable to speak up for themselves. It's speaking up about ideas, you know, how we can do things better, planning a place or a thing. And advocacy can be undertaken in a variety of ways. So you've got individual advocacy, where you're advocating on behalf of a person, or systemic advocacy, where you're trying to change the system. And a lot of peer support groups would be advocating on a systemic level. So there's different ways to advocate. Lobbying, so lobbying government, lobbying private industry, and it's trying to find where you will have the most impact, and that's who you target to lobby. And I suspect in this COVID world, post-COVID world, advocacy is going to look a little bit different. So you may not be able to have face-to-face meetings at Parliament House, for example. It might be done through Zoom. So you might lose some of the impact, but then you might be able to open it up to other people who can advocate in that space by having more people on the meeting call. You can make phone calls, you can write written letters, emails, but you can also storytell by video, and that can be quite an effective way of advocating. You know, people want to hear it from the heart, and they might not remember something they've written, but they will more often remember a patient story that tugs at their heartstrings. And I spoke about individual and systemic on behalf of a group, but it will depend on the need and capacity. And, you know, I know many support groups, including our own, when we really think there's a need for individual advocacy, we will step in and do it. For example, if one of our members has an intellectual disability and they're really lost with the National Disability Insurance Scheme, which is a social service scheme we have here in Australia to support people with disability. We can write submissions. We can subscribe to alerts for these submissions. So health, disability alerts through Google Alerts. So you get notification when these submissions are up. And they can be as simple as telling your story, or you can reach out to a community and include case studies. Often submissions have questions which you can answer. And there's various ways you can write submissions. And you can also encourage your peer support members to write their own submissions. Another way you can advocate, and it's kind of subtle advocacy, but is participating in research. So completing a survey. So an organisation can gather the evidence that can make a difference. And with that evidence, they can go to government or a pharmaceutical company or whoever they're trying to make inroads with, and use that evidence to make positive change. And I'm going to pass over to Monica and let her do the next slide.
So this is something, this kind of advocacy is something that the GSNV is very involved with, and it's more than these are ways to advocate. You have to believe these things, I think, when you're advocating as well. So collaboration as a value of advocacy, I think, is really important. How do you want to work? How do you want to work together with the people that you are trying to get change? What's the relationship you want to have? Because the more people that are working together, the easier it is for that change to occur. So committees and advisory groups, representation is really important, and the GSNV is part. So we are, as I said, a state jurisdiction. We're part of national collaborations to advocate on a national basis, to add our voice to organisations like ours, to strengthen the value of that voice to government and to industry and to anybody else that we need to be talking to, social services and so on. As part of that, as part of representation, one of the things that I do is get involved substantially with research projects and support those. So does Heather, support those as to advocate the position of patients involved in the research, or what's going to happen to the research outcomes. So we deliberately position ourselves to become part of advisory bodies for those research projects, both nationally and internationally. So I'm part of the Asia Pacific Alliance of Rare Disease Organisations, actively involved in Neurotis, the European organisation, and Rare Disease International, the Global Collaboration for Rare Disease, and many other international bodies. I turn up to join the Australian voice to international advocacy, and there's plenty of things that are being advocated for at the moment, such as the Universal Declaration to get rare disease added as part of that. Many things that you may or may not be aware of, but there's lots of opportunity and lots of like-minded people. And ours is a sector of, as Heather said, passion and people who really want change. So representation through committees and advisory groups in collaboration, I think are really important. Who you're going to work with, both as a partner, so maybe you're going to advocate with industry to change government's mind, or maybe you're going to collaborate with a sector that you wouldn't normally collaborate with to try and change something that is happening. So those choices are really important and need to be made really strategically. So petitions are one vehicle that you can use to do that. And I've talked a lot about collaboration and relationship building. So Heather, I'm going to hand back to you.
Thanks, Monica. And so who do you need to advocate to? And, you know, I spoke about government and the private sector, and they both have value. And sometimes you have to try advocating from a number of different directions. One way might not work the first time, or it might just plant the seed. You can advocate to industry, and Monica spoke about building those partnerships with industry to make positive change. Clinicians can also be on your side. You know, they might know of a drug that they think would be a game changer for your condition, but it hasn't gone through, you know, the right trial to determine whether, you know, it's the right drug for your condition. So they might be able to help with that and lobby researchers saying, come on, this is a really interesting condition. Who wants to research it for positive change? And the other thing you can do is look out for change makers and collaborate with them. So I know in Australia, we've got the Australian Council of Social Services and different state-based ones. So a stronger voice, and Monica spoke about this as well, you know, find someone who you can champion with for positive change. And Monica, do you want to do this?
Yeah, okay. So how do you decide what you advocate about? That's a really important decision, because we live in a world that's very crowded with noise about everything. And the pandemic is one of those things that has taken over a lot of headspace and a lot of media space and a lot of pathways that we would normally find as a way in to be talking to people like government, for example, regulators, any other number of different kinds of organisations. So how you make decisions are critically important to how successful that you will be. And one of the ways that I would encourage anybody to make decisions about what they're going to advocate about is have a long list. Everyone's got it. There are many things that need to change for our community. have that list, prioritize it, work with your community on what needs to happen right now. What's urgent, what's medium term, what's longer term, and determine what are the key messages that you want to put in front of people, and then be really consistent with them. Same message over and over and over to the same audience. You may need a different message for a different audience, and that's important too. So having a advocacy plan that says, in this country, we're going to have this as our message, but in this country, we're going to have this as our message. In this one, these are the key messages. That has to be a conscious decision, and it should all be done in the preparation piece. What's the core message? What are the key media messages? So in preparing for advocacy, I'd really encourage people to do it strategically and then work out a very conscious plan to deliver the action.
Yeah, and often they say, like, if you're doing an election campaign, what are your 3 asks? And don't forget, you can use social media for your advocacy as well. Twitter and LinkedIn are very good social media platforms to start conversations, and you can sort of be a little bit cheeky on those platforms and ask questions and tag people in so they notice what your key messages are.
I think too, Heather, just on that, it's really important to be ready for that question from politicians who say, well, what exactly do you want? Like, how exactly can we help?
Yeah.
And often we kind of go in and think we want change, but they're looking for somebody to tell them how they can do whatever it is that needs to be done, because they agree with the what, like they agree with why it's important. But in a lot of cases, if they knew how to do it, or then they probably might have acted before.
Yeah, it's really important. And if you take, a key message away is plan, know your ask, and, prepare as much as you can to make positive change. So we might stop sharing the slideshow now because it brings it to the end, and happy to take questions on this or after Toyin's presentation. But thank you so much, Agnes, for giving us the opportunity to present, and thank you to our listeners and the audience for listening to us. Thank you.
Thank you so much, Heather and Monica. That's very informative. I can see the comments already. Most of us on this panel, we are advocates in one way or the other. And it's really good to know and just learn. And I'm glad this is recorded again so that we can go back and retake notes and just try to see how we can navigate. One of the things, though, that we have found, especially our organization ourselves, it's being an advocate in a country like Australia, and you are the minority, and it just makes it so hard. You can do everything the right way, as you've put it, and you find like all these doors are just difficult to open, and but learning from you and making that noise, and we had an advocate the other day which totally different messages that we got, but I feel making some form of good noise is good to be heard, and as long as you do it in a polite, professional way, that has worked for us. I can tell you the people that we have today at this conference. Natalie is one of the people we started with this organization. It was very difficult for them to open those doors until maybe 2 or 3 years later. And I know because without even saying this, because it's true, because we are minorities in this country and we find it very difficult for those doors to open. And I'm sure people are just watching to see where we are going with this, but I'm glad that we never gave up, and this will actually be able to help us go even further. And we thank you for the work that you are doing and for actually opening doors. You are one of the organizations that have opened the doors for us and be able to let us grow in what we do. So we have a few comments and a few questions at the end, but I'll let Toyin present now. Not sure Ginger is getting up now. We still have a few minutes. Glad we put this for 55 minutes. We still have a few minutes. So Toyin, please take it up. Thank you.
Thank you, Agnes. Hi, everyone. Very interesting discourse, Monica and Heather. And Agnes, I just wanted to encourage you, don't worry, advocacy is even hard here in Nigeria, despite the fact that we have the highest burden of sickle cell in the world. It's very hard. So I think generally advocacy has its challenges, but it's something I realized we have to do. If somebody told me like 13, 14, 15 years ago, I was going to get into the advocacy space for sickle cell, I would have told them they are joking because like most sickle cell warriors, we want to stay in our own space, we want to manage, we have enough issues as it is than to be advocating for other people, as it were. But I'll introduce myself properly. My name is Toyin Adesola. I'm the Executive Director, Sickle Cell Advocacy and Management Initiative here in Lagos, Nigeria. And I got into the advocacy space, I would say by accident. I didn't really intend to enter it. And I wrote a book and people were like, why don't you be a voice for people with sickle cell? And initially I was really challenged in doing it. I didn't think I had the voice. I didn't think I had the energy to do any such things. But as I realized there were a lot of issues, that's when I decided, okay, I'll take it upon myself. And I remember one particular call that changed the whole idea of being an advocate was when somebody told me that his parents didn't want him to go to university because they feel as a sickle cell warrior, he's going to soon die anyway. And that changed my perspective that, wow, sometimes we're like ostriches buried in the sand. We have our head buried in the sand and we don't realize what is going on around us. So it was important for me to find a voice for the voiceless and be able to talk about issues surrounding sickle cell. Now, I've realized something about advocacy. People tend to believe advocacy is the what Heather and Monica were talking about, systemic one where you go and do change policies and all that. But advocacy starts with self. And it's one thing we've been encouraging our warriors, even as patients, to be advocates of yourself. Self-advocacy is very important as a start. Speaking up for yourself, knowing your strengths and weaknesses. I remember I was on admission one day and they were giving me, I'm allergic to some drugs. And I've noticed that people with sickle cell, sometimes when they encounter doctors, whether it's the awe of the doctor, sometimes you don't speak up for yourself, even though you find out that what they're going to do might be and have an adverse reaction to you. So I was telling the doctor that I can't take this drug, I'm allergic to it. And I was speaking up for myself. And when I realized that wasn't going anywhere, I had to go and seek a higher authority, a higher medical personnel to be able to explain to this doctor the challenges. And that's how I escaped being given a drug that could have had an adverse reaction to me. But it starts with speaking up for yourself. It doesn't mean because they're medical personnel or because they have a higher influence than you that you cannot speak up for yourself. You know your own strength, you know your own weaknesses. So it's important that we start with ourselves as advocates, defend yourself because it's important. Nobody will be there to defend you. Yes, there might be policymakers, there might be NGOs like us, but we're not there with you all the time. So you need to be able to speak up for yourself. And that's why it's important to enter into that self-advocacy space so that we can be able to advocate for ourselves. Then we have what I call the individual advocacy, which everybody's doing, where we speak up for other people, we help them find their voices, and it could be family, it could be friends. I had a lot of friends who supported me over the years, and they helped me through the challenges I had when going through sickle cell, because for me, I had a lot of challenges with sickle cell to the point of having an actual physical disability. But with family advocacy, the family has to understand what you're going through. That's why you need to open up to them, not just keep quiet, because sometimes they feel, especially those in the low income space, they feel they don't understand the illness. So they feel that you're being a hypochondriac or you're being lazy and stuff like that. So it's very important that we explain and have a voice with our families, talk to them that this is what I'm going through at this point in time. Explain to them the challenges you're going through so that they can speak up for you. They can speak up for you in school. And when a teacher tells you that you're lazy because you're not doing anything, but not that you're lazy, but because you're not feeling too well, you're anemic. This is where the family and the friends come in. The friends come in. I had friends who used to tell me, Toyin, have you drunk your water? They advocate, oh, make sure she drinks her water, you know, because they were advocating for me. Even when I forgot to advocate for myself. And these are the spaces of informal advocacy that you can enter into, where you can, as a friend, you can support your fellow friend who is a sickle cell warrior. You don't have to wait for the bigger advocacy. These little things help in knowing that that person knows that there's somebody to support them, you know, and even the informal sector, there are people who have their organizations support a cause, you know. It's very important that we get, as organizations, whether corporate or small scale industry, find people within your space. This is what my employers are, and we have an organization here which is advocating for a particular what do you guys call it? Mental, well, I call it mental health, but a challenge that people go through. And it's important that we as corporate organizations, or small scale, medium scale businesses, find our employers involved in volunteering, involved in advocacy for people with sickle cell. Because it's an issue. I know sometimes people feel, oh, we talk about sickle cell enough, but I never feel it's enough. For us, even in this country, with our millions, over 200 millions people, Lagos alone has over 20 million people. We have not scratched the surface. So it's very important that even in a small space, we get people to advocate for people with sickle cell. Even in schools, like we have a school project that we're running, and we're raising ambassadors to advocate within their space, within their peers, for people with sickle cell, and by teaching them what really is sickle cell about, by breaking those myths and negative information that they hear about sickle cell, and telling them what really sickle cell is about, so that they too can, when they hear something negative or something that is a myth about sickle cell, they can make corrections. And these are the ways we can do advocacy. I remember some time ago, as organizations, we pushed people with sickle cell to do an advocacy, because somebody some years back went on national TV and said that having a child with sickle cell is a waste, you know, and there was a lot of upset and annoyance over it. And of course, it gave people who didn't know about sickle cell a different perspective about sickle cell. So we had to do a campaign on Twitter. When they were mentioning about Twitter, I smiled. Unfortunately, Twitter has been banned here. But back then, when we were able to do it, we did a campaign tagged "I no be waste," which means I'm not a waste in our local pidgin dialect. And that thing ran, creating more awareness about what a person with sickle cell is. So it's not, you don't have to wait for the policymakers, the governments to be able to do your own little bit. And this is a message to sickle cell warriors, especially. I know the challenge of stigma. A lot of us don't want to come out, and there are people with sickle cell who are doing very well. We have very good jobs, we're in good places, but we don't want to come out. It's important we advocate, because if not, things will not change. Whatever you went through in order to be where you are, and you pushed yourself to that level, there's somebody going through that struggle even worse, because things haven't changed. So if we as warriors come out and speak, it will change things. I remember I used this analogy about HIV. I remember before there was a lot of stigma about HIV, but now it's not so bad, because people with HIV, people in corridors of influence began to talk about it. began to educate people about it. So these are where the changes will happen if we ourselves come up and talk about it. There's this adage that says, he who the shoe pinches knows where it hurts most. It's easy enough for other people to come and talk about it. But if we ourselves as warriors don't talk about it, people will not really see the impact. There's a bill that's going on, that was going on in our country, and we were trying to push for it and other NGOs, because we have a coalition of sickle cell NGOs. And when we went to the House of Rep public reading, they were saying that they were surprised that very little of the letters were from sickle cell warriors themselves, of the petitions and everything, that they were expecting people like that to come up and talk and defend their own rights and all that. And that is because a lot of us want to hide, don't want people to know we have sickle cell. But if we don't do this ourselves, policies will not change. Because they'll be hearing it from third parties, you know, except for those sickle cell warriors who are running NGOs themselves, which is what eventually happened. The only person in that place that basically was running an NGO and had a sickle cell was able to speak. For people who are third parties, they were not really keen on it. So it's very important that we speak this. Then, of course, we have the systemic one, the system advocacy, where we get policies to be changed, rules and stuff like that. Nigeria for now doesn't have a proper sickle cell policy, which we've been trying to push. And it starts not just from the high level of the national, it starts from your local government, it starts from your state. What is your state policy towards sickle cell, towards people with disabilities? What is your local government directives? You know, things like that. From there, we can now push to the national level, and it takes a collective to be able to push those sort of things, not just one person going to the National Assembly to defend certain bills and all that. It's a collective effort, and it involves not just people with sickle cell, it involves stakeholders, media, corporate organizations, the industries, different people, collaborators, celebrities, to be able to push an agenda when it comes to advocacy. Unfortunately, in this country, there's always a challenge of that collective. Sometimes because we have individual views, and sometimes those views conflict. But I always say, when we remember what our goal is, ultimate goal is, we should forget all the previous plans and ideas and make sure that at least that goal is achieved. So advocacy is important. It's definitely is, and there are different steps. I don't want to go through what Monica and Heather had said, because that is basically what you need to do. But one thing I would say is that if we don't speak up for ourselves, nobody will speak up for us. We need to start the advocacy ourselves. We need to start with self, defending your own rights, defending your own body as it is, because you know yourself, you know who you are, you know your challenges, you know your weaknesses, you know your strengths, you know your capabilities. So we need to start with that. Then you now build on relationships and friends, and then we get to the greater collective by bringing everybody together to make a change and give sickle cell a voice. Thank you.
Thank you so much, Toyin. Thank you so much for that. I agree with everything. I feel like I don't even have to say anything. Look at the comments in the chat box here. I like the self-advocacy part, because surely if you can't speak up yourself, no one will. And as a warrior, as a caregiver, we know exactly what you are going through. And self-advocacy is one of the things that, you know, has helped me, has helped a lot. We are advocates for our children because we walk in this road, and it might be difficult. I've seen comments here from Heather and others not giving up collaboration. That's all we've been trying to do, and we'll continue doing that, because I know if we had not had this zeal and just the perseverance, we wouldn't be here today. And that's why we've continued on, no matter how hard it is. And we are trying to do all the different levels of advocacy. Started with self-advocacy, and then we realized that, no, we need to go into systemic change and try to see how we can change policy. And slowly things are building up. I know 3 years is not too long. Heather, I don't know how long you've been doing this, forever, 7, 10 years. Monica, so many years, and you're still having challenges. So that gives us hope that, you know, we can change, and we won't give up. I want to give Ginger, looking at time, we still have about roughly about 10 minutes. Ginger, welcome. I'm sorry to wake you up so early. So please, you can do your contribution, and then we just do a summary before we finish in the next about 15 minutes. Thank you so much, Ginger.
Well, I want to tell everyone a secret. Good morning, everyone. This is Ginger Davis from Brooklyn, New York. I'm actually in Philadelphia right now, but I want to share a secret with everyone, and it needs to become well known. Self-advocacy is a good thing. And people who speak up for themselves and demand services to be delivered the way they're supposed to be delivered, quality care to be delivered, the proper medication, the proper testing, you know, people speaking with you in a professional manner, and not in a belligerent tone, because they think they know better than you how to deal with sickle cell disease. When you speak up for yourself, you advocate for yourself, and you take additional steps when somebody's behaving unprofessional to report to administration of the hospital how you're being treated, people get the message and they change the way they deal with you. And unfortunately, if you're the only one doing it, it becomes a you and them kind of thing. They won't treat you that way, but they may continue to treat other adults, particularly adults, not so much the children, but adults with sickle cell disease in an unprofessional manner, that borders on medical neglect and medical malpractice. And so self-advocacy, educating the medical staff when you encounter them, you know, and somebody says something untoward to you or is refusing to administer treatment in the way that you're asking, you know, don't get upset, don't get angry, don't return their unprofessional tone. Just speak with them and say, why do you think that? Why are you refusing? Why are you giving me resistance? And, you know, I found even in pain, I know it's difficult, you're in pain, you just want to get treatment, but even then you have to find the strength. And I find we're very, very strong people. You know, unfortunately, we're put in positions that we have to endure pain and fight when you really should be relaxing and receiving, you know. But to do that upfront initially, for people to become familiar with you, you know, in your hospital setting, or even when you walk into a hospital that you've never been to before because you happen to be traveling, you still need to take the time to speak to this other individual and say, hey, listen, this is the disease that I've been living with so many years. This is my standard treatment, regardless of what the books may say, regardless of what the hospital policy is. This is this treatment that works for me. And if you do not have the authority to approve the treatment in the way that I do I need to call an administrator on duty to get them down here and for them to initiate orders for my treatment? See, when you say administrator on duty, everybody kind of takes a moment and they get paused, because when you speak with the administrator on duty of the hospital, it's a formal report that goes in the hospital's general file, and then it goes in the individual employee's file, you know, as a complaint. And when the state's governing body comes in to review the hospitals, they're looking at these things. A hospital administrator does not want the state's governing body to be finding a lot of complaints about something, because they're going to ask the administrator, how are you handling this? How was this situation resolved? Are you providing proper training to your staff? I don't know how and why we ended up getting a stigma about sickle cell disease. And this is internationally. This is not just in Africa. It's not in Australia. It's not in India. It's everywhere. I have no idea how sickle cell disease, as an inherited disorder, developed a stigma that everybody is judged by. But because we don't talk about it, because we don't speak up, self-advocate, and advocate for one another, it continues over 100 years after this disease was given a medical name. The burden for sickle cell disease isn't just the pain. The burden for sickle cell disease is psychological, it is emotional, it is academic, it is social, and it is economic. We get hit in every single direction. When I say academic, I mean the missing of school, the falling behind, having teachers and school administrators that don't understand. And in some places, unlike the United States and maybe Europe, there aren't protections for students with disabilities. So how do you get an administrator to have empathy and to provide support for a student with a chronic illness economically? And that's really the biggest impact for caregivers who can't work because the child is chronically sick, and for adults who find it hard to maintain employment because they're chronically sick. Our communities are living in poverty and under the national guidelines for poverty, because the government subsidies that we need to live off is barely enough to maintain a household, So our advocacy has to go beyond. Yes, we have to educate for the disease, but we also have to address all of those other issues because they're synergistic, in terms of how we need to educate and who we need to educate. We need to educate people in power to make changes so that we're not being impacted. So we're talking about in your Department of Education, your chancellors, your regents, your superintendents. We're talking about in government, all of your legislators at every level. We're talking about hospital administrators. You have the right to go into the president's office of your hospital and introduce yourself and say, I'm living with sickle cell disease, or my child has sickle cell disease, and this is what we need. We need your staff to be trained. We'd be happy to come in and explain to people what our needs are when we come into the hospital. So you have to not just deal with it at the point of contact, because the nurses, the residents, and the attendings who are delivering the treatment are bound by the policies of their hospitals. And in order to make changes in those policies when they're unfriendly to you and your family members, you have to go to administration for that and have a conversation. And if the conversation doesn't work, then you get a little bit more assertive. And then at another point, you begin to legislate their behavior or to modify it through litigation. And that is something we as a people don't use. We take a tremendous amount of abuse. We take a tremendous amount of death, and we do nothing about it. And my recommendation to people is if behavior cannot be modified by conversation, then modify it by legal action. Modify it by getting policies changed from the government level, where now the government is impacting administrators of hospitals to change policies so that they become more beneficial to our population. And, on the opening session, one of your MPs, and I think it was Miller, I forget which one, said, if we do not know the depth and scope of rare disease, then we cannot properly provide for the needs of the individuals who are affected. And so the onus, we have to stop waiting on other people to take care of that stuff for us. We need to start gathering information, our own, partnering with companies or agencies that can show us, or at least help create the abilities within our organization to start collecting data so that we can present information on, if we get proper care, this is how we can reduce costs by keeping people out of the hospital. There are so many different ways that we can do things. This exchanges that we have during the conferences, during Amplified Sickle Cell Voices, is a learning ground. It's a teaching ground and a learning ground. sharing information with one another so that we can begin to put things that are best practices for other rare diseases across the globe into practice for sickle cell disease. So I encourage everyone to get rid of the fear and the apprehension that you may have to speak up for yourself and to actually join a community-based organization near you. If there isn't one near you, connect virtually online. Virtual meetings are here to stay. You can connect with an organization anywhere in your country, anywhere in the world. That's going to help you to learn. That's going to give you the tools, the skills that you need to become a better advocate. And it'll also give you the numbers and strengthen your voice for you to become an advocate that can make a positive impact. So I look forward to our growth, our continued growth, our continued international collaboration and partnership. And we're heading in the right direction. This is finally our time for sickle cell disease. And it's just amazing. And let's all go for the ride.
Wow, thank you. Thank you so much, Ginger. I can't emphasize that enough, everything you've said. And you can see the comments here. And Monica and Heather, these are the issues that we face in the sickle cell community. Our path has been hard, not just in Australia, but worldwide. And Ginger posed the question, like, why is it that the sickle cell community is stigmatized, not just in the US, in Africa, in Australia. And it all comes to this. It's the color of our skin. Without even fear or favor, there's a lot of literature there that has suggested that because this condition affects mostly people of color, this is what we are facing. I keep saying the fact that, Heather, we've had this discussion that I would have given up. And I have tried to give up sometimes, but I've said, if I do, then those people that don't want us to do this work will win. It's been very hard, not just here in Australia, for Toyin, for Ginger, for Sylvia here in Zambia, for others in Kenya. This is what we go through. So we can try to go through the books and say, we can go through the, policymakers and do that the right way. And we've tried to do the right way. And eventually, yes, if you don't give up like this, people open doors. It's been quite difficult. And there's other organizations that judge you, other organizations that want to take up your work. It's other organizations changing their names here in Australia to start doing sickle cell because they've seen that a person of color has started advocating and they want to take up that job to do the work. But we don't give up. Again, it's this color and it's okay. It's just part of life. But we learn from you and we appreciate you opening doors for us, for organizations that are able to work with Australian sickle cell advocacy here in Australia. We thank you because you are doing so much for not just me, but for the people living with sickle cell disease in this country. We have people who have a heart who don't see color. Dr. Margaret Evans-Scalia, she's a woman who's lifted every person, no matter what color of the skin they are. And when we chose her to be a member of our organization as our leader, we saw that in her. She's lifted so many people because she doesn't see color. And we want not going anywhere. We are here and we are going to advocate the right way, but sometimes we will make noise because that's the only way that people can hear our stories. It's been hard, Monica and Heather, but we thank you so much for your support. And there's so many chat messages, but I'll give you the closing remarks. I know the other side has started, it's fine. Isabella, please go ahead and start that session. Heather and Monica, please, just your last words before we go. Again, thank you so much for supporting us.
Oh, look, hats off to all of you working for sickle cell advocacy and trying to make change. Sometimes it does get you down and, I just think you get up the next day, your passion drives you and, Rome wasn't built in a day. And look, there's still many things that haven't happened that I want to happen in, the undiagnosed and rare disease space. But, you keep chipping away, working at different angles, finding people to collaborate with who can strengthen your voice. We're very fortunate in the peer support group sector in Australia. The majority of peer support sector leaders are always happy to share their advice, words of wisdom. I've reached out to many of them, and then I give back to people coming after me. So, you know, don't hesitate to reach out if I can help you in any way, Agnes. So you're doing an amazing job, you know, from 3 years to what you're doing now. I haven't attempted an international conference, so hats off to you and congratulations.
And Agnes, I hope you know that you will always have our support as well. And to have you as part of, and sickle cell disease as part of the rare disease family in Australia, I think is really important, because as Heather said, it's an amazing group of inspiring people that work so hard for everything that is achieved, and nobody can do it on their own. No one. And your logo, Together We Rise, you know, together we are stronger, together our voice is louder, together is the only way. So we as Will Swan and every other rare disease group in Australia, and I hope around the world, will work with you to change people's lives and make this world better for everybody, because that's why we're all doing what we're doing, isn't it? Thank you for all that you do, all of you. You've all been incredible. Thank you.
So much. Toyin and Ginger, I'll give you 1 minute each, then we can close. Thank you so much.
All right. Thank you, everybody. I think the main thing is, as I said, we need to do collective advocacy. Somebody was asking a question, how can we support? And I think the most important thing is open doorways for us. Sometimes we don't know how to get to certain areas and all that. And you may have that network or that influence to say, okay, go here, go there. You know, I always tell, that's why I was talking about people of influence, celebrities, or even if you are not, sometimes you may know somebody who knows somebody. And that helps a lot in pushing advocacy. Yes, funding is important, but also that network is your net worth, as they say. And so when you have that connection and you're able to drive through those networks, it's very important that we do it as a collective society. And just remember the people that we're trying to help. Yes, we have our own individual goals and visions, but remember one person we're trying to help. Thank you.
Okay, so I guess I'll chime in. Yes, for support, yes. Just increase your numbers by 1, and it'll grow exponentially from there. You know, as a child, even in pain, I would get up out of the bed and go help the person next to me, because in my mind, they were suffering more than I was. You know, and we didn't have electric heating pads at the time, so it was go boil water and make sure that cap was on tight and wrap the bottle and put it where they needed. You know, they tell you put it here, you know, and massaging each other and helping them to drink water from the cup, you know, and we did it without calling the nurses. We supported one another, even in pain. And we have to be strong enough mentally, emotionally, and physically to help ourselves and help one another, even in pain. But, you know, when you're not in pain, that is the best time to get up and really do the work. You know, when you're feeling healthy, on your good days, that's the time that we need to get up and come together and begin to do the work. And it doesn't matter what you don't know, just be open to learning. You know, seek out the people. And again, beyond sickle cell disease, when we're talking about rare disease, there are other people who've been at it sometimes longer than us. You know, say, hey, would you be willing to teach me? And what can we do? And how do I say this? And understand also, when you're advocating, it's not I, it's we. You know, even in a situation in an emergency room, when you're trying to advocate for yourself, somewhere in there, you have to say we. So things don't just change for you, it changed for others as well.
Thank you so much, Ginger. I mean, we can go on forever. This was a very good topic. Again, thank you so much for supporting us. Heather, Ginger, Toyin, Monica, we appreciate you. Thank you so much, everyone who managed to join us. We'll go now and support Yvonne and the team from Nigeria with their initiative. They are doing a newborn screening in Nigeria.